Good afternoon. This is Jassim Al Suwaidi. I'm a consultant cardiologist, Chief of Scientific, Academic, and Faculty Affairs at Hamad Medical Corporation. I'm Professor of Clinical Medicine at Weill Cornell Medical College, Doha, Qatar. I'm really honored to be part of the speakers for this important conference. I'm going to talk about increasing access to care discussion section. I'm going to share with you the Qatari model. Well, as you know, each country has their own healthcare access model. And in Qatar, it's a small country in the Middle East. The healthcare is basically divided, as it's the case in all the countries, into public sector and private sector. The public sector in Qatar has primary healthcare centers. There are 31 primary healthcare centers in Qatar that provide primary healthcare to patients, including general medicine, pediatrics, obstetric, gynecology, as well as some secondary specialty clinics. And we have Hamad Medical Corporation, which is the main hospital in the country, main corporation. Under its 15 hospitals, it also provides ambulance service, home residential care services. Now, we also have private hospitals, around 8 private hospitals and 226 healthcare centers. All public and private sectors are really regulated by Ministry of Public Health. Now, in Qatar, 85% of healthcare is provided by government-funded system where healthcare is really free of charge to all inhabitants in Qatar. And as I said, Hamad Medical Corporation is the main corporation that provides secondary and tertiary care in the country. Hamad Medical Corporation has 15 hospitals. The first hospital was opened in 1957, Rumaila Hospital. The second hospital was opened in 1982, Hamad General Hospital, which is really the main general hospital. Subsequently, different hospitals were opened throughout the years, as shown in this slide. The most recent one is Aisha bint Hamad Al Atiyah Hospital in 2022. With the increase in hospital openings in Qatar, that resulted in significant increase in bed capacity that's available to our patients. As shown here, the bed capacity in Qatar has increased. That's the public, not the private. The public increased from around 50 beds in 1960 to almost 3,000 beds in 2020. These beds includes general acute, critical care, rehabilitation, long-term care, daycare, and isolation rooms. And the number of physicians and healthcare professionals has increased. For Hamad Medical Corporation, we almost have more than 30,000 staff providing services to our patients. This increase in activity over years corresponds with the increase in the population in Qatar. In 2011, there were 1.4 million population in Qatar. In 2022, 3 million. So it increased 100%. And with that increase in the population, the inpatient admissions has increased 5 times from 36,000 to 150,000 in 2022. The emergency visits has increased slightly, and I will explain why there wasn't a significant increase in emergency visits over the years. Surgery has more than doubled in Qatar as well. Well, as shown in this trend, the emergency visit has increased a little bit because of the significant increase in outpatient services that was made available to the residents in Qatar and reduced the pressure or the need to go to the emergency room for taking care of these patients. Also, the opening of urgent care centers around the primary health care has improved that. And for that reason, the number of emergency visits did not increase tremendously. I'm going to share with you also two unique events we've gone through in Qatar and how the healthcare service has responded to them. The first one was COVID. And as you know, healthcare has responded to globally because it was pandemic. And because of the close cooperation between primary healthcare, secondary healthcare, same software access data to the patients. The ambulance service is also under the same institution, and the coordination with the other governmental institutions had made it run smoothly, so to speak. In Qatar, COVID mortality was one of the lowest. In Qatar, we had the highest vaccination rate in the world. In response to the COVID pandemic, the bed capacity increased from 2,200 acute care beds to over 3,000, and the intensive care beds increased from 130 to 750. 37,000 beds in multiple isolation facilities were made available to healthcare professionals. Lab capacity up to 40,000 PCR tests per day, free of charge to all inhabitants in Qatar. And the introduction of telemedicine and virtual services made it easy to follow up our chronic patients and make sure these patients have been followed up closely and did not miss their health care. As an example of the excellent service provided, our primary COVID facility, which is Hazm and Barik, won the top Arab Hospital Award for its response throughout the COVID pandemic. Our cooperation between Hamad Medical Corporation, primary healthcare centers, Ministry of Public Health, and the two medical schools in Qatar, Weill Cornell Medical College, as well as University of Qatar Medical College, as well as Qatar Genome Project, resulted in significant data collection and resulted in significant, very important publications, multiple publications in New England Journal of Medicine, Nature, Annals of Internal Medicine, on the Qatari experience, basically with the COVID and COVID vaccination and their response. The second experience, which was also unique in Qatar, FIFA World Cup 2022, that happens immediately after the pandemic. Luckily, with the organization and learning through the COVID pandemic, it made it easy to take care of that major events. The Ministry of Public Health, in coordination with all the healthcare facilities in Qatar, made it easy access to healthcare service during the World Cup. In fact, over 50,000 World Cup patients received medical care. Multiple clinics around the country and in the stadiums were made available, and many ambulances were made available. And in fact, many staff were available close to the events. And of course, all of these services were free of charge to all of our guests in Qatar. Hamad Medical Corporation, as well as healthcare in Qatar, always strive to have world-class standards of care on top of providing easy access. I'm going to give you some examples of key performance indicators. For example, emergency waiting time was significantly reduced over the years. The average time for cardiology from arrival to PCI is 48 minutes, primary PCI versus 90 minutes, the international benchmark. Stroke management is also the timing significantly reduced. Cancer referral, 95% of patients are seen within 48 hours. Trauma mortality rate for the past 4 years has demonstrated significant reduction because of the efficiency of the system. And as I said, the ambulance service also has played an important part in providing a quick response and coordination between the different hospitals and institutions. To strive to quality and safety accreditation, Hamad Medical Corporation has multiple accreditations from different international bodies that monitor excellence in cares, as well as policies and procedures, including Joint Commission International, CAB accreditation for the labs, and many other international bodies as shown in this slide. Future priorities for our institution is supporting the implementation of National Health Strategy, launching a 5-year HMC, Hamad Medical Corporation strategy, exploring the opportunities and meeting the challenges of the National Health Insurance Scheme, which will be coming in effect this year, and excellent coordination between the different healthcare institutions, academic medical centers, medical colleges, as well working with our international partners and colleagues. And I thank you for your attention.